Ladies and gentlemen, and my dear colleagues in the Diabetes Challenge, good morning and welcome from the UAE on a bright sunny morning. This is the fourth DiaBeat webinar, and we will be talking about diet and diabetes. As is my habit, prior to any webinar, if I am doing the introduction, I try and read up on the subject to understand what we could be getting during the webinar. And I came across the 5 best and the 5 worst foods for diabetics. Now, let's start with the 5 worst. I have the list in front of me. They talk about French fries, beverages that have sugar, bread, rice, pasta that is processed, that would be white bread, white rice, and pasta. They mention fried foods and chicken. And unfortunately, or fortunately, as the case may be, they have included beer and alcohol. Now, these are apparently the worst foods for a diabetic. And so, with great trepidation and fear, I decided to look up the best foods for diabetics. And I came across this austere list which said simply and straightforward: vegetables, fruit, whole grain, fish, yogurt, and in capital letters, water. I am hoping that our speaker today, and it'll be my great pleasure to introduce our speaker, will be a little kinder in prescribing a diet for us diabetics. What appears is a difficult diet, but I'm hoping that our chief dietitian of the RAC hospitals, Miss Ruba Alhourani, is able to help us with a few delicious recipes. Now, Ruba is an extremely qualified individual to talk on our subject today. She is not only the head of department of the RAC Hospital's dietary department, she is, in addition to being a nutritionist, she is a holistic individual in the sense that she is a health coach. She specializes from a nutritional aspect in therapeutic diets and deals in our hospital with inpatient, outpatient clients, clients with cardiovascular disease, clients with endocrinic problems, including, of course, weight loss and other such aspects. She spans the entire age group of human existence: pediatrics, adults, geriatrics. And it is a pleasure to know that she is a member of the Arab Nutrition Association, the Emirates Medical Association, the American Academy of Nutrition and Dietetics, and the European Society of Nutrition. Ladies and gentlemen, you could not have a more qualified individual to talk to us about the vagaries and the specialities involved in a most important correlation of diabetes, and that is diet. Both diet and diabetes start with a capital D. Ladies and gentlemen, our speaker, Ms. Ruby Alhourani.
Thank you, Professor, for this nice introduction. And hopefully we can share whatever it's possible within this time to have a brief and focus on the most and the major points regarding management of diabetes through diet. So let me share my screen. Hopefully today we'll be able to list and highlight the most important points on focusing on the diabetic diet and what are the nutritional goals to cope up with a healthy lifestyle and to manage blood sugar or also improve it. And we will mainly focus on carbohydrates as it's highly involved in the diabetic diet. And then we can go through the concepts of consistent carbohydrate diet and how to use it in our diet in a conscious way. And then if there is any concern, we will cover it in the end. And as we know, diabetic diet, it can be as simple as meaning eating healthy, varied diet that focuses more on enriched nutrients and more quality food choices. And the importance of following a diabetic diet, not a low carbohydrate diet, which two small phrases are really different, but you need to understand the difference between these two kind of diets or phrases. As following a diabetic diet, it doesn't mean a low carbohydrate diet. It's basically a healthy eating plan that is rich in nutrients and it's balanced with a proper proportion appropriate to each person's individual needs. So that means not everyone are supposed to receive the same calories or the same percentage of the macronutrients, which we will talk later on. But let's rather say that it is basically combining the most appropriate proportions based on individualized needs. The diet that are rich in a variety of healthy choices, in fruits that are low in glycemic index, vegetables, and other whole grain products that are really high in fiber, which has a major effect on controlling the blood sugar. So basically, it helps by following this diet, which we refer to as a diabetic diet. It will help not only in maintaining the blood sugar, it will also help reduce the complication of blood sugar, maintain a healthy body weight, and also reduce the risk of having any other health concerns, health problems like blood cholesterol, and reduces the risk of having cardiac diseases. So it starts by whenever the person is diagnosed with a pre-diabetic, not only diabetic. So this is the time where you should start taking care of the type of food and the way you are living, taking care of your lifestyle in general. So this means you need to highlight what are the major risk factors. So if you're having overweight, you are overweight or obese, you're having extra body weight, not only to lose weight, you need to look into the fat content because body weight is just a number. We need to look into the percentage of the fat and the muscles and other proportion, because an obese person could have like a very high body mass index from muscles, but yet very low fat. So these percentages also matter. We can check it usually with specific machines, but if you can have a look on the way the body is shaped, especially if there is accumulated fat around the abdominal area, this is where you need to have a concern about your health and reevaluate all the other health triggers in your body. Set a goal where priority is to lose weight, and then to fix your lifestyle. If you are inactive or sedentary, or you're having, let's say, more hours spending behind the screen or the office, you should look into a solution where you become more active, involve more physical activity in your life. And this also involves the sleeping pattern. So if you are not used to have a good, proper quality, good time of sleep, this has to be highlighted, because it's highly important on regulating the hormones that are responsible for controlling the blood sugar. So by following that, starting with following the most important points, you should be able also to reduce the risk of developing any other health problem, including cardiovascular diseases. And if you are already having or diagnosed with any other health problems, starting off with reducing or improving your blood sugar is highly connected to reducing the other risk factors. So in general, this diet not only focuses on better carbohydrate portions or on options, it also involves lowering your intake from the total fat, replacing the saturated fatty acids, the unhealthy fat, with healthier options, and making sure that it is within the proper limits that your body needs. Different type of diabetes are being treated with the different techniques and the different plans, but I will not focus more on type 1 diabetic, because we know that it is insulin involved, dependent, and usually I'm just gonna highlight that usually if a diabetic person is already on medication, especially injectables like insulin, his blood sugar is very important to be monitored closely, as they can develop hypo and hyperglycemia, which is a very high or very low blood sugar, as it is directly connected to the amount of carbohydrate they are consuming. So, which means the type of diet, and not only that matters, also the amount of carbohydrates in the food should be monitored, because each unit covers a serving of carbohydrate, which is around 15 grams. The other type, which is the most common and most related to body weight and lifestyle, which is type 2 diabetes, it could be managed without medication. It's up to the amount of blood sugar or the accumulated blood sugar, and it's decided with the treating physician. But usually, if it is not treated with any medication, it's highly dependent on the diet and lifestyle. But it doesn't mean also those who are on treatments and medication, they don't require a diet. The higher effectiveness of the treatment plan will be improved if a diabetic person following diabetic diet and a healthy lifestyle. Basically, in this patients or people with type 2 diabetes, their goals should be focused on the weight control, as I mentioned, on the usage of carbohydrate counting method, which I will explain, and address the other health problems and risk factors. So, as I mentioned, carbohydrates is the basic macronutrient that usually diabetes being affected with, because it's sugar, okay? And it's digested quickly from 15 minutes to 2 hours. And it has direct effect on the postprandial blood glucose, which means whatever you are eating, then it's gonna cause a spike in the blood sugar. Now, how likely or how fast this type of food will increase the blood sugar, this is what we call glycemic index. So we always need to look into the amount that each type of food that we are consuming and what is the time that it increases the blood sugar, then we can decide if it is a healthy carbohydrates or not. And then carbohydrates, it's usually in everything that we consume except for the proteins and the fats. So fruits are carbohydrates, vegetables are carbohydrates, dairy is carbohydrates, sweets, pastries, and all of that, beans, pulses, it's all considered carbohydrates. But as I mentioned, the type of carbohydrate is different. The amount of fiber and sugar is different, and the way the body is absorbing that is totally different. And to maintain the body's energy, our consumption from calories and from overall food, it should not be less than 50% unless if we have another or specific health concern. So as an average, an adult diabetic patient, he should be consuming from 45 to 55% of calories from carbohydrates. The rest will be distributed between from proteins and fat, aiming to have a lean protein or healthy protein that are less in fat proportion and cooked in a healthier cooking methods, as involving our meals and adding protein, proper portion. It will help in feeling more satiety, give us the feeling of more satiety. And then as it takes longer time to be digested, from 3 to 5 hours, and then it will help us retain our energy and muscle mass, and it will also help us in a better digestive properties, and then it will give us that energy and feeling of not having or consuming more of carbohydrates, because typically if there's imbalance of the macronutrients, we're going to have more or less of any of the other macronutrients. And to maintain a good muscle mass, as I mentioned, as we usually start losing, in general, if we start losing the weight, to maintain that muscle mass and to make sure that our loss is only from fat, we need to have around a serving, two servings of protein on each main meal, which are the breakfast, lunch, and dinner. Many sources give us a good option of lean protein. But basically, the lighter the meat or the lighter it is, the less fat it has. So this gives us a hint that the fish are containing the least amount of fat, followed by poultry, and then meat comes as the end option. Of course, there is a plant-based options that needs to be combined with good whole grain products to be able to give the same benefit as the animal-based protein and give us the same variety and the value. Could include soybeans, nuts, and then pulses, and so many other options. Dairy and eggs also will give us a good amount of protein, but it should be also limited, because dairy it increases the blood sugar. Obviously, it has carbohydrates. And then the eggs, if it is cooked or taken into higher amount or higher portions that our body needs, then it's gonna be affecting our cholesterol and give us a little spike of blood sugar. Talking about fat, which is very important not to neglect, don't worry about the term fat, because fat can be also healthy. Focusing on enriching our body with healthier options like unsaturated fatty acids, for example, plant-based oils or raw nuts, fish, avocados. This will help us feel also full for a longer time, and it will increase our metabolism as we are giving our body its needs from everything, and fulfill our needs from omega-3, and then it will help us with reducing the bad cholesterol and so on. Healthier options, as I mentioned, should be aimed for at least 5 to 6 servings in a day from fat, which is no more than 50 grams of our total caloric intake. So how do we plan our diet according to our needs? according to our body. We get to decide how many calories that your body needs to consume, and based on that, we give the proportion, as I mentioned, with the macronutrients. And that should be also focused and considering your goals, your lifestyle, everything, your culture. So you will feel comfortable while you are on this diet. Dieting is not always, as I mentioned, restricting the food. Dieting could be just eating healthier, okay? We're still humans, we have different needs, we have different occasions, we have also ups and downs, we can get sick. So always our diet should be highlighting all of the other factors and making sure that you are comfortable and understanding that this is for a lifetime, it's not just a matter of time. The diet should be focusing, as I mentioned, on the healthier option of each meal or each macronutrient. So when we talk about carbohydrates, so it means that we need to limit the refined and high or simple sugar from our diet as much as possible, because this is where we get a spike or an increase in the blood sugar, because it is very quickly absorbed, increases our blood sugar directly, and then it imbalances our insulin and hormonal distribution and levels. So make sure that you are having higher fiber intake, more of whole grains. Make half of your grains whole. This, keep it as a rule. And then include a lots of starchy vegetables like broccoli, spinach, that are high in fiber. It will make you feel full, and it is basically very high in water, and it's very low in sugar and calories. And try to replace, for example, the sauce and any additives in the food that are high in sugar also with healthier options. This will help you to have a more balanced diet. One of the methods, and the most popular method that you should follow while having a diabetic diet or following a healthier lifestyle is counting your carbohydrates. So in the beginning, the first what you need to do is to identify the carbohydrate sources. So as an example, we're going to eat breakfast. So where is your carbohydrates coming from? Either bread or oats or whatever. Then you need to estimate or measure the portion size. So if you are going to have 50% of your food, as I mentioned earlier, from carbohydrate, which means around 15% to 20%, no more than that on the main meals. So let's say your higher intake or the biggest larger meal is in the middle of the day, which is lunch. So you need to make sure that if you are going to have 3 servings of carbohydrates, you don't increase the intake on other meals, so you have a balanced and within the limit. So if you had 2 carbs in the evening, 2 carbs in the morning, 3 carbs in the afternoon, then try to limit carbohydrate sources in the snack if you are always on a habit of having snacks in between. Now, having a snack doesn't necessarily to be happening. It's up to you. It's if you're feeling hungry, you can have a snack, grab a snack, which is no more than 150 calories. You can have an options that are low in sugar, or you can skip it, but it is always good as a diabetic patient to have small, frequent meals, as it will help in regulating the blood sugar and will make you feel full, especially if you're starting on a different lifestyle or an eating habit. Then the third point that you need to do is to quantify the carbohydrate for the meal, either by servings or by grams, which I'll explain. And then make sure that it is being prepared in a healthy option. Like, for example, if you're going to have rice as the source of carbohydrate, please make sure that it is not frequently fried. You can have it steamed, you can have it just boiled, herbed, that is up to you. Make it, it's not necessary to be boring. You can add a lot of spices within the limit, but do not have it with cooked on a very bad way or on a more regularly. After that, you need to specify and check if this type of food is causing a very a raise in the blood sugar, because I will tell you something, because usually this insulin sensitivity is different between each people. So I might get a very high blood sugar spike after eating an apple, but someone else would not. So you have to identify and understand how your body works. And there where it comes the importance of checking, keep checking your blood sugar. So as a diabetic patient, you need to have at least 4 records in a day of in a different timings of your blood sugar, so we can understand where the lack is, where is the gap is happening. Is it from food? Is it from medication? Is it from the type of food? Is it from a specific situation? And we can help you better, and you can help yourself better to have a better blood glucose readings later on. And make sure that it is always combined with the other food groups, which I mentioned, protein and fats. And as fiber slows down the increase in the blood sugar, and you have to make sure that it is consistent. So if you are usually having carbohydrates in each meal, so make sure that it is always in the same amount. Specifically, if you are taking medication or you are like on a routine, like you're working and you're having your lunch every day by this time, the breakfast by this time. So the body starts releasing the hormones and regulating the insulin and all the other things more appropriately. One of the most, or let's say one of the easiest methods to evaluate and count the carbohydrates is by using the healthy plate method. Which emphasize or like that as the serving or 1 serving of carbohydrates around 15 grams of carbohydrates. So how does it look like? It's either a slice of bread, half a bun, half a cup of potato, and 1/3 cup of cooked rice or pasta, and or it's a 1 medium fruit. So basically it's around 1 fist. It is easier for some people to estimate it by using their hands. It's okay, but you should always know that around 1 serving is it's gonna give you 15 grams. So if you're going to have 50% of your calories from carbohydrates, this is very important to understand that you are adding more servings, you are adding more grams, so it will increase the percentage of the food, the macro in your diet. By estimating the amount of carbohydrate using the My Plate, it will help you to cover your needs, same time keep within yourself within the limit. So imagine that this is your plate. Okay, you can divide it in the similar way. Make sure that quarter is protein, as I said, 30 grams, around 30 grams minimum. 30 to 60 to 90, it's up to your needs, because heavier person, they need higher calories, obviously. So this can be decided by us. And then you quarter only is the carbohydrate. As I mentioned, it could be from any kind of grains, it could be from the starchy vegetables, which are the pulses or the for example, potato. Remember, root vegetables are starchy vegetables, okay? Anything that grows in the under the ground. And then half of your plate should be from non-starchy vegetables. So this can be divided to either half-cooked non-starchy vegetables like broccoli, and then half a salad, or it could be 1 full half of a salad or 1 full half of non-starchy. It's up to you, the way you like it. And then make sure that water is being consumed in a proper amount. So an adult needs average by day 8 to 12 glasses of water. Your needs, again, increased or decreased and being decided by and evaluated by your health condition. And you need to keep and make sure that the portion size and serving size aren't always the same. So if I tell you that the portion of, like, let's say you are going to consume a prepared or a packed meal, such as biscuits, okay? We know biscuits is a carbohydrate food. In that, you need to be able to estimate what is the serving size. Portion size is different than serving size. What I mean, in a pack of biscuits, you will receive around 12 pieces, okay? But doesn't mean that this is the portion, okay? It will mention in the back of the biscuit pack the nutritional facts, which is mandatory to be there on all the food items in the supermarkets. You will read a serving size is equivalent to either 2 pieces or 3 pieces, depending on the product. So in that serving size, how many carbohydrates? So it will mention it has 15 grams, it will have 20 grams. So this means that you are having 3 portions of carbohydrates if it is around 45, okay? So always make sure to be on the safe side whenever you are having a packed food, which I don't really recommend, but if you are going to have a biscuit or a ready-made meals like an oat biscuits or something, make sure that carbohydrate content in a serving size is not more than 15 grams. So it's one portion, okay? So this is very important to understand. Now, the portion of protein is totally different because proteins, they don't contain carbohydrates, they contain fats and protein. So a serving of protein is around 3 ounces, which is the palm of the hand, okay? And then the serving of dairy, it's either a cup, which is around 240 ml, okay? Or 2 spoons of cheese or 2 spoons of cream. It's considered as a 1 serving of protein and carbohydrates at the same time. Okay, fruits, it's around 1 fist, carbohydrates, it's around 1 fist, and then the non-starchy vegetables, it's 2 handfuls. Okay, this is the easiest method. And then fat is around 1 thumb, which is around 1 teaspoon. So if your allowance per day is 3 servings or 3 spoons of fat, this is your limit. This is your portion size. So as an estimate, this is really helpful. If you were going by the same basics that you're gonna have 50% of your carbohydrate intake from total calories intake is around 50%. So if you are going to consume 1200 calories, around 10 servings. If it is around 1500, again, it's another serving. 2000, this is decided by your body mass index. We usually help you in that, but it basically an average adult female, she needs between 1200 to 1500 calories, and male needs 1800 to 2000 calories. Okay, this is a simple example of a diabetic diet plan that contains 12 to 13 carb servings, which is around 180. That is 50% of the 1500 calories. So on the breakfast, 4 carbs of servings, it means around 1 full cup of oatmeal. Remember, I mentioned that 1/3 of a cup of oat means 1 serving, okay? And then 1 cup of skim milk. This is again another serving, and 2 tablespoons of raisins. This is 1 serving. So this is 4 carbohydrate servings. So by lunch, if we're going to have around 3 carb servings, it's gonna be like a sandwich, small salad, and 1 fresh fruit. So I recommend the higher amount of carbohydrate to be in the lunchtime rather than dinner, specifically if you are having long hours and working during work, don't neglect yourself and forget yourself with work. And leave yourself without food for a long time. This is very bad for controlling your blood sugar. So make a target that like by 1 o'clock maximum, you'll be taking or consuming your lunch that contains the higher amount of carbohydrates. As the day goes by, you know, your energy levels are retained, and then you will be most probably sleeping by 9 or 10 o'clock if you are not going to stay up late. So this allows the body to digest the carbohydrates and then make yourself full for feel not very full and have that discomfort while you are sleeping. So I'd rather have the heavier meals on the earlier in the morning or in the afternoon. As a fact, if you lose only 7 to 10% of your current weight, it can help lowering the blood glucose from 1 to 10%. And make sure that specific small modification, like having better having better cooking methods, lowering your fat intake, increasing the high fiber, it has a very good impact on lowering the blood sugar. And not to forget that we need to combine to have a better outcome for reducing the blood sugar. We need to combine the healthy diet with exercise. 75% depends on the diet, but there is 25% depends on the exercise. 5 to 7 days a week, it's up to you, it's up to your time, but we need to have a target of 150 minutes of moderate to high intensity exercise. It's not low intensity. But if you tend to like your goal is to lose weight, we need 300 minutes per week. You need to know that higher fiber intake, it increases satiety and it slows the absorption of carbohydrate and modify the postprandial glucose intake, at least 25 grams a day for women and 35 grams a day of fiber for men. And switching to a lower fat intake diet, all diabetic patients will improve their cardiac risk. They will modify their outcome, their cholesterol levels, and even their blood pressure. And what happens if you are a person that eats or dines outside due to work or spends the weekends with the family? It's okay, but you need to be mindful, as I mentioned, about your portion sizes and making sure that it is a healthier options. Like, for example, instead of having something that is fried, you can have grilled meal or steamed. You can always cut your meal into 2 halves, finish the first half and wait, drink some water. If you're still hungry, you can eat some more vegetables, but never increase your carbohydrate intake more than what is specified for your needs. Okay, and you will adapt by time. You will learn, you will teach your body to understand the needs. And this is how you will stop feeling hungry. If you are feeling hungry, it means that you are having less fiber. Okay, so you can increase fiber in the beginning, you can increase the protein, but never increase the carbohydrates or double it. You can increase little bit, or we can start with a higher portion to adjust to your needs later on. And let nothing that can be treated by diet be treated by any other means. Thank you, everyone. And I hope I covered everything, but I'm ready for questions if there is any concern.
Ruba, great words of wisdom. Great words of wisdom. Thank you very much. And I will just draw to your attention and to the attention of our audience some of the pearls of wisdom. You mentioned over here that a diabetes diet is not necessarily a low carb diet, but a healthy carb diet. And that is important. And you specified that healthy carbs are carbs with high fiber, and that includes fruits and vegetables. You also mentioned that a good diet does not necessarily restrict food, it is eating healthy. And that, I think, is a very wise way to look at dieting. It is indeed a very wise way. And you also specified, it's not something I find specified often, that a snack is no more than 150 calories. I will keep that in mind when I am snacking the next time. I tend to eat too much when it comes to snacks. I will now know, and Ruba has told me it cannot exceed 150 calories. I will make sure about that. And then it was kind of you to accommodate some of our other speakers. In this instance, I talk about our last seminar, which spoke about exercise, and you said very kindly that exercise plays an important part in diabetes, but remember that diet is 75% and exercise contributes 25%. Thank you so much for that. A very wise, talk on diet. I've taken away a lot from that. Thank you so much, Ruba. And I will now hand over to Dr. Wilku. And Dr. Wilku is an expert over many years in asking the right question. So Dr. Wilku will now, with your permission, Ruba, ask a few questions. Sir, the floor is yours, Dr. Wilku.
Thank you very much, sir. First of all, thank you to Ms. Ruba for a wonderful session. As always, you touch all points in a simpler way so that each individual participant can understand and follow. It's wonderful. So, as usual, diabetes, the topic and the diet is very confusing. Everyone has different notions. They follow the doctors, they follow the counselor, they also follow, mainly, they follow the internet and the Google teachers, and they get confused. And there are a lot of questions every time when we talk in the group talks or health sessions like that. So here we are having very wonderful questions. I was just going through it. First question I will pick. Harsehed is asking. He is concerned about his mother. Is protein diet safe for my mother as she is diabetic and has a joint pain? What diet she should be following?
Okay, so based on this question, there is a lot of things that we need to know. The background of his mother, is the joint pain coming from any inflammation, arthritis, or is it just spike in the uric acid? Is it related to diabetes? Because as we know that as a complication of having elevated blood sugar, there is neuropathy, there is joint pain. This is usually need to be addressed and looked and evaluated by the physician. So, and specifying more, protein diet, it's not as a phrase, it's like there is no high protein diet alone, because as a person, as an individual, your mother has needs. Is she covering the needs? This is the first question that you need to know. Is she consuming all different sources of protein? If she's not, and she's having low protein diet that not covering her needs, that may contribute to her joint pain, because obviously the muscles will be weakened and then she will have pain in general and difficulty in walking. So we need to evaluate how much she's taking, and is she taking proper sources, and other factors that influence her blood sugar and any other health concerns.
Yeah. Thank you. Second question comes from Sarfraz Sheikh. My father has diabetes and he feels very low whole day. What should he take? This is very commonly means expressed questions and concern, because people are afraid of eating that because they have to control the calories, and they eat very less, and they choose wrong things and suffer from low energy. It's a very wonderful question, ma'am.
Yes. As you said, doctor, because usually they are afraid to consume high calories. So usually they are underestimate their needs. They eat less amount of calories than their needs. So eventually they will feel tired. He could be feeling tired because if he's not eating a balanced diet, which means he's taking protein and no fat, he's taking very low carbohydrates, high protein, and etc. So this is one. Another point is he needs to know if he's on any other medication that is causing and contributing to this tiredness. If the dose of the medication is very high, if we are talking only about blood sugar, if the dose is high and then he's eating very less, this will make him feel low all the time. And energy comes basically from food, and a major source of energy is carbohydrates. So if he's eating once or twice, usually people with age, they don't have that much of appetite. If they are consuming less calories, less amount of meals, this will also contribute to his energy. So make sure that he's taking proper amount of food as per his needs, and make sure that he is having variety and balanced diet. Then make sure also he is drinking water. Sometimes dehydration is giving him this feeling of becoming weak majority of the time.
Yeah, true. That was a wonderful explanation. Now, Dr. Madhurima is asking one question which comes very popular nowadays. People follow a lot of diet plans to lose their weight, and keto is one of the best chosen diet formats. Even knowing it whether it suits the body or not, people start following, seeing others also they are doing. So, in this connection, Dr. Madhurima is asking: is keto diet good for diabetic people? Does it really help to maintain the blood glucose levels?
Based on my experience, what I've seen of obviously because they are cutting down carbohydrates, the blood sugar will go initially and will improve. The blood glucose level will improve, but later on they will end up with other complications like high cholesterol level, kidney stones, high uric acid because of the very high amount of protein intake. So if it can be followed for as a target of weight loss, it should be for a short period of time, but also with monitoring the blood sugar. Because if it is on a real keto diet, which means 30 or 50 grams of carbohydrates or less, this can bring the ketone level very high in the blood, and this is very dangerous for diabetic patient. So I'd rather say for a diabetic patient, don't follow a keto diet. You can follow other means of diets, Mediterranean, intermittent fasting. This all can help to reduce both weight and improve the blood sugar and reduce the risk of complications later on.
Yeah, true. The next question comes again. This is a wonderful question because we come across many times. Many people have confusion on this. Shiv Shankar is asking. He is diabetic. His doctor says what he's saying. His doctor says to avoid juices and eat a lot of fruits. He is making juice himself and he's not adding any sugar. Is it good?
See, if it takes you to make a cup of juice, 4 to 5 pieces of fruits, imagine, can you eat that much of fruits at once? Fruits, again, it's carbohydrates and it's sugar. But what happens is when you juices out with the fruit, you will lose the fiber. Fiber is actually the main focus in the diabetic diet. So what happens is you will be consuming higher sugar amount and then more calories. And remember, always liquids are very highly absorbed by the body. So it can increase very high spike in your blood sugar and later on disturbs the accumulated levels of blood sugar. If you want to have a fruit juice every once in a while, you need to look into your blood sugar first if it is not very high, and then follow the portion size. Portion size of a fruit juice is half cup, which is 120 ml, which is equivalent to 1 full fruit. So if, again, if you're diabetic, you are not supposed to eat too much fruits. It's limited also. You can have fruits, but not more than 2 to 3 servings a day. In the end of the day, it is carbohydrates and it will affect your blood sugar. So I'd rather say, yes, you can eat fruits better than juices, but if you're going to have a juice, you need to reduce or omit the serving of a fruit that day.
Yeah, true. I think this is the best explanation I have ever heard. Thank you, Ruba. Next question comes from Ranjit Kai. Is low fat, high protein diet, you have already covered this, maybe he didn't get it properly. Is low fat diet and high protein diet good for diabetes?
Again, it depends on the percentage, as I mentioned before. If you are going to have low fat diet up to certain amount, of course, you're gonna improve your blood sugar because you are not affecting your lipids and cholesterol. But eventually, if you're going to have a very low fat, you need to increase your protein and carbohydrates. Make sure that it is within the limit so you will not harm yourself.
True, true. One last question. Again, this is intermittent fasting. Many times we have spoken about in weight loss challenge and previous diabetic challenge also, and we come across this query many times. Now there is another thing, carbohydrate cycling. Harshad is asking: is intermittent fasting and carb cycling the same? Which is better?
Now, these two things are like two diets are totally different because intermittent fasting, you are restricting the time of the food and fasting. It's either 24 hours to 24 hours or you are 16 to 8 hours. So you are having a gap where you are eating. It doesn't mean that you are having less carbohydrates or more carbohydrates. It's just the amount of time you are having is restricted, regardless the amount of food or the macros you are taking. Carb cycling is different, where like you're going a cycle of 3 days, 2 days, where are very high carbohydrates, then medium, then low carbohydrates. So this usually is not in a favor of a diabetic patient because he can go into hypo and hyperglycemia and disturbs the blood sugar as they don't have consistency in the amount of carbohydrates, which I highlighted in the presentation. If the patient is, the person is doing, is an athlete and he is targeting a specific thing, it should be under supervision and his blood sugar should be monitored very closely. But it's not in a favor of a diabetic patient. Intermittent fasting, in the other hand, it could be because we are just limiting the amount of carbohydrates and then the body will be understanding and focusing on a time where the person is eating, regardless the amount of carbohydrates or the calories that he is taking. So a person who was used to eat late at night, this is in a favor for them, especially a diabetic patient. He will not be having the same habits as before. So he will restrict eating later on, and then the blood sugar will eventually be improved. So on comparing between the two is totally different, these two diets.
Yeah, that was a wonderful answer. And even personally, if I have been asked about this question, generally I suggest carb cycling to avoid because it also disturbs your metabolism, whether you are diabetic, whether you are obese, or whether you have any chronic disease. Somehow it disturbs the metabolism and leads to other chronic ailments. And intermittent fasting is a little bit good. I agree with you, but it has to
Not for
be
a
done
prolonged
in a
time.
proper way. Yeah, not for a longer time. Okay, that's good. I think we have covered almost all the queries. And in general, in one line, what should be your suggestion for our diabetic patients?
As a diabetic patient, you should always have a healthy lifestyle, and that combines with everything that we have mentioned: stress, exercise, sleep, and then diet. And diet, it should not be they should not think about it as it's a matter of a time. No, diet it's not diet, it's healthy eating pattern. Okay, so you are what you eat. Exactly. So if you're going to eat things that will influence your health, you're gonna see it on your health later on, if it is bad or good, positively affecting or negatively. So make sure that you are covering your needs, you are not exceeding your limits, have a variety of food, and always get evaluated by the physician, and always get advice from expertise, because whatever applies to you doesn't apply anyone else.
Yeah, thank you very much. I will close with, I will hand over to Professor Kennedy with a tagline you just used. You eat what you are. That is very good. So I will always remember this. I will always advise people, always follow what you are, just eat according to that. Professor Kennedy, over to you.
I have said thank you to Ruba, but I will have to say thank you once again. Wisdom, wisdom, wisdom. I mean, here we have a colleague who has the courage to review world famous diets and have an opinion about it. You are talking about the keto diet, and Ruba had an opinion. You were speaking about intermittent diet, and she had a technical observation. It's enchanting to have a courageous speaker. I think that was excellent and that was profound. And in simple things, which we spend a lifetime learning, and yet we don't know until a brilliant speaker comes across. How much of fruit should a diabetic eat? I didn't know the answer to that question, but Ruba has told me. Maybe 2 fruit at best. And what is the ratio of fruit to fruit juice? I would never have known that it was half a cup of fruit juice equivalent to 1 fruit. Now, thank you very much for that, Ruba. And Dr. Wilku, thank you, sir, for the questions that you ask. It brings out the brilliance in a speaker. And that is a great quality that you have in the questions that you ask. So, my dear friends and colleagues, Dr. Wilku and Ruba, thank you so much. And my thank you doesn't only extend to our brilliant speaker and the cornerstone of these webinars, Dr. Wilku, it also extends to our audience who are kind enough to listen to us week after week. Now, our next webinar will be conducted, as I see it, I believe it will be on the 22nd of September. The next webinar is on the 22nd of September, and our speaker at that time is none other than Dr. Wilku. Dr. Wilku will be talking about alternative therapies and diabetes. That will be an interesting topic, especially since it comes from an allopathic institution like the RAC hospitals. But the RAC hospitals has retained Dr. Wilku, who is a certified, qualified UAE alternative medicine specialist. And we can look forward to exciting things in the webinar on the 22nd. Same time on the 22nd. With that, ladies and gentlemen, thank you very much for listening in to our webinars, and we look forward to seeing you again next week.